The topic was chest pain and what we get concerned about when it comes to chest pain. So, chest pain here, mid-sternal pain that is worse with exertion, walking, running, or pain that is worse with stress, but also pain that gets better with rest or medication called nitroglycerin. If you have those three things, we really want to work you up to make sure that you don't have a potential heart attack. So we can do this with uh, heart catheterization. We can do this with a stress test. We can do this with an echocardiogram. Depending on how risky you are, will let us know whether we should do a heart cath or a stress test or an echo. For instance, I've had some people who have already were high risk, and I'm pushing for a heart catheterization tomorrow. There are some that are getting a stress test tomorrow, and there are some that we're waiting for an echocardiogram. And all of that can just give us enough information to be able to risk stratify to make sure that we don't need to rush for a cardiac catheterization. This is in addition to things like an echo and labs such as a troponin, which if positive and you're having chest pain or other concerns, we can proceed with a cardiac catheterization. One of the things that we always have to make sure is that women and people in other demographics that don't have the classic presentations, that we believe them, because you can have atypical presentation but still have significant cardiac disease. You can have things such as shoulder pain, shortness of breath, back pain. There's been cases of people who have had the flu that ended up being cardiac disease. So we want to make sure that we do our due diligence, whether it's a stress test, echocardiogram, to further evaluate these individuals to make sure that we're not missing a potential life-threatening, life-altering heart attack. So, one of the questions is, since panic attack, my heart has not been the same. Can I tell you more? And the short answer is no. Not just telling you. What we typically do is work people up for their palpitations. Palpitation is a very vague symptom. Unfortunately, some people can have palpitations without any changes on the EKG. It can be associated with caffeine intake, excess caffeine intake. It can be associated with stress itself, but it can be normal in a small population of people. So we want to make sure that your palpitation is not something more dangerous and concerning, such as atrial fibrillation. The first way that we start with evaluating that is with an EKG. To look at what your rhythm looks like. Sometimes it may not capture it, so we may do a heart monitor, and those heart monitors can be as little as 24 hours. I usually don't do 24 hours, but can extend upwards to 30 days to see what your trend is, to see if there's any changes throughout the day. Is it worse at nighttime? Is it worse during the day? Is it worse with activity? And usually with that, we can evaluate. It can tell us what we need to know regarding what's going on. But just from symptoms, you can't really tell what's the true etiology, what's the true cause of it. But that was a really good question. That's one of the things that we evaluate people for with a heart monitor for palpitations. But one of the things that we also have to pay a close attention to is the impact on um, the stress in life itself and mental health and how it can affect our heart and with palpitations. So if all the cardiac workup has been negative and you're still having palpitations, then we definitely want to take into the fact that anxiety does exist, mental health does exist in ways that we can cope through it. But you also want to decrease potential stressors, excess caffeine, etc. Oh, that was a really good question. The next topic I'll discuss is expand more on palpitations. Um, but I hope you guys got benefit from this, Dr. Isang, and I'll be back tomorrow, maybe.